Today we're going to talk about scaphoid fractures, which is a common injury in this large bone of your hand. The most common cause of injury is whoosh, or fall on an outstretched hand. If you're falling forward from skateboarding, from snowboarding, or if you're old and you have lack of balance and you fall forward, the first thing you do is reach out your hand. The first point of impact is this bone, scaphoid bone. On exam, often we see is decreased range of motion. So you have difficulty flexing and extending your wrist. There's a lot of tenderness in this place called the snuff box, some swelling and redness associated with it. What's special about the scaphoid bone is that it's a large bone, and the way that the artery goes in, the proximal pole of the bone is not getting as much blood supply as the distal pole. And it matters because if you fracture the proximal pole, the chance of non-union and from avascular necrosis is quite high. That is when you don't have enough blood supply because you cut it off with a fracture and that part dies. And if it dies, your bone won't heal because it doesn't have the blood to create the matrix and reform a new bone. And the main thing about this is that when you just had your fracture, when we do an x-ray, it might be negative in an acute setting. You can only see it on an MRI or a CT or a bone scan. And we do that for patients who are professional athletes or if they practice at an elite level at around 48 to 72 hours. This is an example of a scaphoid fracture right at the waist of the bone. If your history in exam is suspicious enough, even though your first x-ray is negative, we will still put your thumb in a spica splint and re-image it in 10 to 14 days. It takes time for that to develop. Now, if there is a fracture on the first x-ray, then great. We will still put you in that spica cast. And if it's, depending on where it's broken, if it's in the waist, we'll keep it in for 10 to 12 weeks. Distal pole, 4 to 6 weeks. And you want to continue to immobilize it until on x-ray we see that the bones are healing. Now, when is it necessary for surgery to happen? Depending on the location of the fracture. Like I said previously, proximal pole of the bone have the least blood supply. So if you have damage to that area, you might need surgery for good union. If it's displaced, so if it's that far apart, it doesn't matter how you immobilize it, there's not enough space for the blood to reach. If it took you a long time to present, so more than 3 weeks, that'll be a concern. Or if there's joint problems or dislocation between the scaphoid bone with the bone surrounding it.